Hi everyone, this is Mitch of All Trades and welcome back to my channel. If you're new here, welcome. My name is Michelle. I'm a registered nurse and a nurse practitioner student. And this channel is basically all about my life as a nurse, as an NP student, everything revolving around it. If you're an oldie, I would say welcome. Thank you so much for clicking this video. Thank you for supporting me. Thank you for subscribing. Thank you for being a part of a family. Thank you for being an OG. In this video, I will be talking about how to really find out what nurse specialty is for you. Finding a job might not be hard. It might be hard, but also finding a nurse specialty that you want to start off in. Sometimes it's recommended to start off as a med-surg nurse and to work your way from there. But some people, they're willing and eager to start off in the specific career path that they want to do. So this video, we're going to be talking about how to find the nurse specialty that is for you. I believe that's a topic a lot of people don't really consider till they're actually about to start applying for jobs, because there's so many nursing positions out there, but you want to pick the one that you're interested in. You want to pick the one that feels more fulfilling to you at the moment, and you want to pick something that makes you happy, at least, and makes you feel like you're walking in your purpose. Now, I would say there are about 6 things that I'm going to talk about that I believe you should consider when choosing a nurse specialty. Number 1 is your personality style. Let's say, are you type A or type B? Are you more aggressive? Are you more passive? Are you relaxed, reserved? Are you very energetic? Do you like talking to a lot of people? Do you prefer not to talk to a lot of people? Because depending on your personality, you would perform better in certain nurse specialties. For myself, something that I considered is that my personality, I'm more reserved, laid back. I can be social, but sometimes I like to, stay in the back and just do my work and stuff like that. I'm also very attentive to detail. And because of that, I picked certain specialties that worked for me. And I think that I thrived in the specialties that I had worked in, like the ICU, for example. So you have to think about, what are your strengths? What are your weaknesses? Are you talkative? Do you like a fast-paced environment like the ER? Are you more attentive to detail, flexible and spontaneous? Do you like kids? Another thing is work style. Consider your work style. What works best for you? Do you feel like at this point of your life, are you better off working in the physical hospital, or you believe that working at home would benefit from you? Do you like a more physical active job, or would you like a less physical active job? So that will determine if you would prefer to work as a school nurse or rather work in the hospital, like I mentioned earlier. Age group preference. Now, this is my favorite because I think this is one of the easier things that people use to gauge what specialty they would rather be in. Do you like working with babies? Do you like working with neonates? Do you like working with children? Do you like working with adults? These are things that you might consider thinking about when choosing a specialty to work in. I follow this nurse YouTuber. Her name is Alexis Nicole on YouTube. If you're watching this video, hey girl. And right off the bat, after nursing school, she knew that she wanted to work with newborn babies. And even though she tried different career paths and different specialties, she knew that working with neonates was something that she was passionate about, and she knew that right away from nursing school. And I think because of that, it helped focus her lens on where she wants to end up working in. Also, I would say another thing is gender preference. Would you like working with women, mostly pregnant women? Then that would, you better off thrive in, let's say, the labor delivery department or the mother baby department in obstetrics and all that stuff. Women mostly have a specialty of their own because of like the different things that come with women's health. So if that's something you're interested in, that will also determine what nurse specialty is best for you. Another thing to consider is the work environment. I think I touched on that earlier. Let's say I had one of my nurse mentors who had kids, and she usually used to work in a hospital, but then she had to switch to work at home at a desk job, and you can definitely explore that if that's something that works for you at the moment. So there are different ways you can work under insurance. You can work as IT, working in a psych unit where there's less like patient care required in terms of like cleaning and IVs and all of that stuff. Or let's say dialysis environment, which is mostly outpatient. Is that something that works best for you? These are other things that you can consider as well. But I do think that if that's something that works for you, then that will determine what specialty to choose. So yeah, you have to consider work environment. What's the best environment that I can work in it? Am I able to work in a hospital for 12 hours? Am I able to work there? Or do I believe that working at home is what's best for me, and depending on that will determine what works for you. And lastly, work hours. Some people are better working 8 hours. Some people cannot do 12 hours. Some people can love to do the 12-hour shifts. And I think right ahead, if that's something that, is a deal breaker for you, I think that's something you have to consider while choosing a nurse specialty. Now I'm going to talk about practical ways on choosing a nurse specialty, and this is what I did for me. This is what worked for me. Number one, learn from experience. So clinical rotations are the best way to get the experience or the knowledge that you need to determine what nurse specialty is good for you. So for any one of you guys that are in nursing school, I would recommend using your clinical rotations as the best way to figure out, where do I want to be at when I am done with school, when I am working? What specialty works for me? I remember for me, during clinical rotations, I'll use that time to explore different departments and talk to nurses and try and shadow different people under different units, and use that time, because with clinical rotations, you do get a chance to work in different units. Well, not really work, but just, have your rotations in different units. So I used to utilize that opportunity, like they taught us, to just explore and see what works for me and see what I like and what I don't like. And from there, I was able to use that to determine, okay, where do I want to work after graduating? Another thing is research. I think that's another major thing as well. Doing your research, be it watching YouTube videos, watch different nurses. A lot of vlogs are out there, day in the life vlog of this and that, come to work with me vlog, this and that, different videos of nurses doing a talk down about their specialties and what they like and what they don't like. And I think from doing that, also reading blogs and just getting all that information, it can help you determine, okay, I like this. I think I would be better in this specialty. I think this specialty is for me and I'm gonna pick that. So I think watching videos, reading blogs, getting advice and doing your research is another key point in determining how to pick a nurse specialty for you. And another one I would say is trial and error. Trial and error is one of the more expensive options, because at the expense of switching jobs frequently, you're, I guess, trying and seeing what works for you. There are nurses that have done it, and I would tell you that rather than choosing, trying, and suffering in a specialty that you don't like, I would, advise you to do the first two first and use those options in determining what nurse specialty is for you. Granted though, when you start working as a nurse, you might realize, this is not what I thought it would be. This is not what I thought it would be like for me. And that's understandable, but that's another way of determining what nurse specialty is for you. I do believe that there's a specialty that everyone has that maybe gives them that fulfillment. And once we find that specialty, we would know that, okay, I like what I'm doing, and it'll make us feel more fulfilled rather than just working and being burnt out. But yeah, following your passion, following what your calling is, will attract other good things around you. So it's important that there is that specialty that you decide to pick from that gives you that joy. I think for me, working in the ICU, I did know that I would like to work in the ICU because I did my research and I knew my personality was made for that kind of setting. But also pediatrics is another specialty that I would like to explore. And I do believe one day I will explore it, and I'm gonna find some fulfillment in that, because also from experience, clinical rotations from research has shown me that I do have a passion for it, and it's a specialty that I will be good for as well. Now, it's possible to have multiple specialties that you're good at, but these tips that I gave are tools that you can use to determine, what job do I want to work as and what specialty do I want to pursue after graduating as a nurse. So if this video helped you, make sure you give it a thumbs up, make sure you comment your thoughts and any questions that you might have. Make sure you subscribe to this channel if you have not, and make sure you hit the notification bell to get notified every time I post. Thank you so much for watching this video. I love you guys so much, and I'll see you in my next clip. Bye.